on the edge. The UK's oldest populations are concentrated in rural and coastal locations, and this imbalance will only become more stark. Providing healthcare outside urban areas could prove to be one of the defining challenges of the next few decades. We ask those already doing this work to share their knowledge. This article for the Podiatrist was written by Jess Connett and Helen. Part 1. Introduction. Running the smallest territorial health board in Scotland might sound easier than a comparable job in a major city. But mix in 70 wind-battered islands, a population that can swell by a third overnight when cruise ships dock, and the increased supply costs of a remote location, and suddenly it doesn't seem quite so simple. The added complexity of an island health board brings quite different challenges, says Skaife-Knight. She has been chief executive of NHS Orkney for just under 2 years. She says, "You either have to get off the island by boat or by aeroplane. It's not until you live on an island that you realise what comes with that." Laura's annual budget for patient travel is £1.4 million. She says, "If we were to send a patient from here to Aberdeen, for outpatient appointments, for operations, for various tests and scans, that's about £400. That is a lot of money each year. And that's without air ambulance costs." An emergency involving a person from a cruise who needed specialist care recently racked up an eye-watering bill, Laura says. The cost of transferring that patient to a hospital in Middlesbrough was £15,000 by air ambulance. Yes, we recoup the cost. But at the end of the day, we're the NHS, and it's still the NHS's budget, however you slice it. Part 2. Midlife migrations. Despite the relative remoteness of Orkney, the car ferry from Aberdeen takes over 6 hours. The island's population grew by 15% between 2001 and 2022. This was the 5th highest percentage change in Scotland and almost double the national average. The over 75 age group saw the largest change, increasing by almost 77%. Conversely, there was a 9% decrease in the 25 to 44 age group. It's a similar story across the UK. Younger people gravitate towards urban areas, while an opposite migration takes place just before people hit older age. They live out their retirement in rural places with a slower pace of life but sometimes fewer services. Laura says, "We have a lot of patients aged 90 to 100. It really shows when you're on our wards. Our population as an island is growing, and at the moment just over 25% of our population is over 65. That trajectory is to increase over the next 5 to 10 years. The overall ageing of the UK's population is driven by 2 separate trends: increasing life expectancy among older people and younger people having fewer children than previous generations. Part 3. Predictions. England's oldest populations currently live in 8 local authorities, including parts of Dorset, East Sussex and Lincolnshire. In these 8 areas, between 14 and 18% of residents are aged 75 or older. By 2043, people aged 75 or older could represent 25% of the population in more than 50 local authorities. And the distribution is particularly striking. Coastal and rural areas including Scarborough and Norfolk are predicted to become home to the oldest populations, while cities like Manchester, Birmingham and London could have populations of over 75s as low as 2%. It's the same story for Ards and North Down on Northern Ireland's east coast, Pembrokeshire and Anglesey in Wales, and all across Scotland's Highlands and Islands. As people aged 50 to 69 present to podiatrists most frequently, providing services to those who need them may require a shift of focus away from urban centres in the near future. Part 4. A lovely place to be. What draws a podiatrist to a rural setting? Tracy Darville moved to the Isle of Lewis in the Outer Hebrides in June 2023. After 33 years working in the NHS in London, she was seeking a better work-life balance. She took off in her camper van with her husband, and took locum jobs between adventures. One locum role was at NHS Western Isles. "We both loved it here," Tracy says. "It was just a lovely community spirit. We loved how everybody was supportive, how beautiful the beaches were, and the facilities here." Tracy's husband secured a job, and they made the decision to move permanently to a house 2 minutes from the beach. For others, satisfaction comes from working in the place you grew up in and serving your own community. Alicia Kirby returned to her native Cornwall as a diabetic specialist podiatrist after studying in Brighton and working for a period in London. She has now served the West Cornwall community for more than 20 years. "Having grown up here, I have a good geographical knowledge of the area. I understand the challenges and just try to enable patients to reinforce their quality of life," she says. While living in a place that's a desirable holiday destination has its challenges in terms of housing costs, of course it's a lovely place to be, Alicia adds. Laura says of Orkney, "To be surrounded by water and the sea and the beach every day, you become spoilt. It's beautiful." There are downsides as well. You haven't got everything on your doorstep, so there are compromises you have to make. But it's an absolutely stunning place to live and work. That's brilliant for your own well-being. Part 5. Private Practice. When Tracy moved to the Outer Hebrides, she couldn't find a suitable NHS role, so she set up as a sole practitioner. "I was inundated with patients," she says. "Many weren't eligible for NHS services or had been discharged but still needed support. There's a great demand for care," she says. She has clinical bases in and around Stornoway, but offers home visits all over Lewis and Harris. "In one day, I could do 200 miles to go and see a few patients," she says. This is where the tight-knit community comes into its own. "I might go to Uig, a 110-mile round trip," Tracy explains. "The population in that area knows I'm coming. They might go around to one person's house and get me to go there. And while they sit and have tea and chat to each other, I see them one at a time in a room of the house. It cuts down my travel costs, so then I don't have to charge them extortionate amounts of money to go and treat them." That isn't to say things are always easy. When Tracy began practicing, she needed to order equipment. One item cost £50, and I got quoted a £500 delivery fee, she says. Obviously, I didn't pay that. With the help of locals, she found a company to courier the delivery from the mainland and cut the fee to £10. Often others have already overcome the problem you're experiencing, she says. You simply have to ask. Part 6. Facing the challenges. Delivering care in rural places often means problem-solving. Transport is a big issue in Cornwall, from infrequent bus services to high taxi costs. Alicia says funding and staffing constraints limit the team's ability to offer home visits, but they have services in place to ensure patients have access to care. These include an emergency access referral system, patient transport if they are wheelchair-bound, and transport services whereby more mobile patients can pay a certain amount per mile. Alicia says, "We can link with the community nurses to do virtual care plans as well. We do quite a lot of shared care with the district nurses." Laura says, "A bit of tension that I'm increasingly alive to is that, as the smallest territorial health board in Scotland, we get all of the same demands as the big boards. But we have not got the infrastructure. We've got 800 staff here, and most wear not just 1 or 2 hats, but perhaps 8, 9, or 10. However, help comes in many forms. The voluntary sector is absolutely massive and thriving," she says. From charities that support older people to the men's shed in Stromness, the community looks after its own and plays a key role in preventative care. That spirit is fostered and folded into NHS services through partnerships and multi-agency work. Laura says, "Because of the unique challenges, you have to be innovative in your solutions. Things that would work in other health boards just would not work here," she reflects, and solutions that would be impossible in a big city work perfectly in the island's tight-knit communities.